Hello, I am Natalie MacLeod, and I'm very happy to present our study that looked at the prevalence and follow-up of incidental pulmonary nodules found on chest CT in the ICU. The need for diagnostic imaging, such as chest CT, is particularly high in critically ill patients. As we know, ICU patients will undergo transitions of care that increase the risk of losing clinical information, including incidental findings that require follow-up. A pulmonary nodule is an example of such an incidental finding, and the Fleischner Society has developed recommendations regarding the follow-up and management of incidental pulmonary nodules detected on chest CTs. Our group previously found that 13.5% of CT pulmonary angiography studies completed on patients in the emergency department and inpatient ward settings identified incidental pulmonary nodules requiring follow-up. Of these, just under 50% had evidence of appropriate radiographic follow-up. However, the prevalence and follow-up rate of incidental pulmonary nodules among ICU patients is unknown. So we sought to first determine the prevalence and follow-up rate of incidental pulmonary nodules requiring follow-up found on chest CTs completed on ICU patients, and second, to understand the factors that promote or hinder timely follow-up. To achieve these objectives, we performed a retrospective cohort study that included all ICU patients who underwent chest CT at Mount Sinai Hospital from January 1st, 2014 to November 30, 2019. We excluded repeat CTs, and patients who were less than 35 years of age, had known active malignancy, had goals of care defined as comfort measures only, who died during the follow-up period, or who had nodules suggestive of an alternate diagnosis whereby the radiologist did not recommend follow-up. Our results demonstrated that of the 312 index chest CTs included in the analysis, 162, or 52%, contained pulmonary nodules. However, following application of the exclusion criteria, there were no chest CTs with pulmonary nodules that required follow-up. In fact, of the entire 312 scans analyzed, only 3 CT reports suggested follow-up imaging be completed. However, all 3 patients died during the follow-up period from a cause unrelated to the pulmonary nodule. In conclusion, these data demonstrate that while pulmonary nodules are prevalent, incidental pulmonary nodules requiring follow-up can be a rare finding among critically ill patients. As such, while providers must remain vigilant to ensure such findings are not missed, system-based solutions may be needed to prevent such rare events from falling through the cracks. Thank you.